Hello everyone, myself Ruchi Patel, working as an assistant professor at LJ College of Physiotherapy. Today I am going to take second year topic, that is kinetics and kinematic analysis of ADL, that is activity of daily living. In that we are going to see about overhead activity, and in that particularly we are going to study about throwing activity. Okay, so let's start with the presentation. Anyone can throw a ball. That is, overhead activity is possible for everyone, right? But not everyone can do it well. So while throwing a ball appears a simple movement, but it is actually a complex sets of movements. Accurate pitching with the force, the speed, and the power of particular group of muscles in the body, which requires the entire body and not just the shoulder and arm. So overall body's musculatures get activated during the throwing activities. Every part of the musculoskeletal system is literally involved for this throwing activity. And if any of these movements is affected, then they can make the ball to go somewhere else that is not intended to go. So the phases of the overhead throw consist of wind up phase, stride, coking, acceleration, deceleration, and follow through phases. So we'll see here, that is the wind up phase. During this wind up phase, there will be the adduction and hip flexion movement. Here the upper extremity's role will be less compared to the lower extremity and the trunk. Then this stride phase, this is the stride phase. Arm cocking phase, here the maximum movement of the shoulder also will get start. Then arm acceleration, so here the ball or the shoulder will come for the maximum external rotation movement. Then arm deceleration movement, that is during the acceleration to the deceleration phase, this external rotation of the shoulder will occur initially, and then it will go for the internal rotation. And then the ball will get released from the hand, and then the follow through phase will come. And during the follow through phase, the body will get relaxed. So these are the basic phases. Mainly while doing the throwing activity, these all the phases will be present. There will be some variation according to the sports activity. Okay. Okay. So first, the phase, that is the wind up phase. In this phase, the overall, whenever we do throwing activity, it is approximately a 2-second motion. And in that, particularly the wind up phase, it consumes approximately 1.5 seconds of the time. Okay, so we can imagine that the maximum time we are spending in this wind up phase, and the remaining in the remaining second will finish all the phases of the throwing activity. And it is the beginning of the throwing motion, preparing the body parts for the act of throwing a ball. And motion occurs in the lower extremities and torso, where the vast majority of the power to throw a ball is generated during this phase. Here, the shoulder musculature's activity will be minimal. Then the second phase, that is the cocking phase. In this phase, the body will get prepares the arm for to throw a ball, and the posterior shoulder musculatures, that is the extensors muscles and external rotators muscles, will get activate more. And during this phase, the body begins to move in the forward towards the target. Okay, then here the shoulder external rotators strength is must, that should be in a proper amount to provide the full rotation or external rotation motion. then acceleration phase. So during this phase, the arm which is in the posterior direction will come in the forward direction, actually towards the target, and anterior upper quadrant muscles are get concentrically activated and begins to move the arm from the external rotation to the internal rotation motion. Okay, so here the body proper mechanics places the shoulder in the proper position to go for the internal rotation movement and to generate a proper velocity and accuracy without causing any injuries to the shoulder. So after this, deceleration phase will come. So when the ball is released, the posterior quadrant musculatures begins to contract eccentrically and violently to slow down and to control the rotational movement speed of the humeral head. So to control the internal rotators muscle work, these posterior quadrant muscles will work eccentrically just to avoid the injuries of the shoulder musculatures. And the last phase, that is the follow through phase, it is the final phase of the throwing activity, and this phase shows that all the body motions and all the movements will get slowed down and stops the forward movement of the body, and the body comes to rest and the muscle activities returns to its quiet state. So in this phase is, if it is completed correctly, the thrower's body position is under control and it should be in the balanced position. So till now we have seen related to the phases, that is wind up phase, then arm cocking phase, arm acceleration, deceleration and follow through phase. So mainly till now we should know about the activities of the shoulder muscles, that here the posterior and anterior quadrant muscles will require in a proper way. Initially, the posterior quadrant muscles will work concentrically and gradually, once the maximum external rotation will get completed, then the release activity will get start, and during the arm acceleration and deceleration phase, internal rotation will takes place, and here the anterior quadrant muscle has to work properly and it has to generate the proper force. And last, during the follow through phase, all the muscle activities will get slowed down and the body will return to its original position. During the arm deceleration phase, the posterior quadrant muscle has to work eccentrically just to control the movement, that is forward movement of the shoulder musculatures. So now we'll see the activities of the muscle in this whole movement, and at individual joints which all movements will occur from initial to the last phase and which muscle has to work, that we'll see. In this table, you all can see I have mentioned about the joints, movements, which all muscle has to work, initial position and final position, and the type of muscle force. Okay, so we'll start from the upper extremity, that is from the wrist joint. So as we all know that during the last throwing motion, the last phase, the last movement will be flexion. The muscles which has to work, that is the flexa carpi radialis, flexa carpi ulnaris, flexa digitorum, that is the flexors muscles of the wrist joint. It has to work, and during the initially there will be the hyperextension movement of the wrist, then in a final stage there will be flexion, and of course concentric work of all these muscle is required. For elbow, there will be the last movement, that is extension. Here, for the extension, triceps and anconeus muscle has to work. Initially, there will be the flexion motion, last extension. The extensors has to work, concentrically. Then we have radioulnar joint motion. Of course, as we all know, the pronation motion is required. The pronator teres, pronator quadratus muscle has to get activated. Initially neutral motion, then it will go for the pronation, and initially the isometric work is required. Then concentric work of this muscle is required. Then coming for the shoulder, as we all know, the extension motion and last movement will be extension, and even we require the internal and external rotators muscles to work. So here we'll see the muscle work, that is the deltoid, posterior deltoid muscle, latissimus dorsi, teres major, teres minor. Initially the flexion motion will be there, then there will be the flexion motion, then it will go for the extension and external rotation, and then again it will go for the flexion motion. So the deltoid muscle, then the coracoid muscles, and there's all the muscles and the teres major and teres minor muscle, as well as the internal rotators, that is subscapularis muscle has to work, and this muscles work concentrically. Then the shoulder girdle, that is the downward rotation and depression motion. Here the trapezius and pectoralis minor muscle has to work, that provides the downward rotation and depression motion, and it works concentrically. Then coming for the trunk motion, the trunk flexion motion will occur because we move in the forward direction. So the uh, core muscles, that is the flexors muscles, that is rectus abdominis muscle, internal oblique and external oblique muscle has to work. Initially there will be hyperextension and then flexion movements will occur. This all muscle has to work concentrically. Then we'll proceed for the lower extremity. There will be the slight flexion motion initially, and then it will be go for the flexion and adduction motion. Here iliopsoas, pectinis, then rectus femoris, sartorius, adductors, all the muscle has to work, and these muscles work concentrically to produce this motion. And at the last stage, there will be the slight flexion motion, and this time also the flexors muscle has to work concentrically. Then coming for the knee joint, there will be the extension motion. So initially there will be the flexion motion, and then goes for the extension motion. The quadriceps muscles has to work concentrically to produce this motion. So this is the brief idea related to the overhead activities, kinetics and kinematics. You all can study in the detail in the books related to this analysis, and we can include the many things in this, but the basic thing which we require for the analysis that I have mentioned here. Okay, so thank you.